So you're 65. That means you're eligible for Medicare. Guess what? Even if you don't need the benefits, you still have to enroll in Medicare. Why is that? Well, our Medicare and health insurance experts are here to explain why. Catherine Sevier from AARP, Steve Edmonds from Alliance Insurance Services, they're taking your questions. This is your chance to get an expert to answer your question. So this is how you do it. You're going to text us the question. The number is 336-379-5775. It is just that easy. You text it in and we are going to answer that question. All right, Catherine, let's start off with what we normally start off with when we talk to Medicare. And this is kind of like what we did there at the very beginning. You have to sign up at 65. Why do you have to sign up at 65, Catherine?
Because the government says at 65 you are eligible for Medicare, and whether or not you are going to start using all of it or not, 3 months before the month of your birthday or 3 months after, you need to go on the Medicare.gov site and sign up for Medicare. If you don't, you will be blessed with penalties for the rest of your life. Now, what you can do is you can choose, if you're still gainfully employed, to waive your Part B until you need it or until you're no longer insured by your insurance company. But you still have to do that, or you could be hit with penalties for the remainder of your life at a premium of about 10% per year. So you don't want to do that.
No one wants to pay more money for something than they should, right? So again, very clear, you must sign up for Medicare at 65. Now, what Catherine just said is, if you're working, you can defer Part B. Let's talk about Part B. Steve, what is Part B?
So Part B is basically your medical benefits. So it would include things like doctor visits, specialist visits, anybody working in the health insurance field that you go see, like a physical therapist, a radiologist, on and on and on. All these folks get paid from Part B. So it's a very big part of Medicare. Part B also covers stuff like lab tests. It covers stuff like x-rays and some of the more expensive scans, CAT scans, MRIs, PET scans, things of this nature. And it also covers things like durable medical equipment, things that you might need at home. So Part B is a really big blanket coverage of your Medicare coverage.
All right, and so when we're talking about this, and we're talking about Part B, and we're talking about that you have to defer it. I think sometimes people go, all right, what does that mean? So Catherine, let's like really break it down. You are going to sign up for Medicare, which is basically Part A, right? And then what do you have to do to defer Part B?
So you have to indicate that you are still employed and that you have a credible insurance plan that is in force. And you can defer your Part B, which means you don't have to pay the premium for Part B, which right now is about $175 a month. Part A is free. So as long as you're working, have a credible insurance plan, you may choose to do that. And then your credible insurance plan will pay for all those things that Steve just mentioned. If you don't do that, and later you decide to sign up for Part B, you will be penalized. So you want to make sure that you either sign up for it or you can defer it. Check with your HR department.
Right, it's actually like a box that you have to check, yes?
Yes.
Like physically a box you have to check. Now, Steve, I know very often you'll say, you know what, to double check things, you might want to call. And who would you call to say, hey, I want to make sure I did this?
You just call Social Security. And there's an 800 number. It's easily accessible on the internet. You always want to look for that. It'll be Social Security Administration .gov. And all of the .gov sites that you see, usually those are very credible, because when you get on the internet and start searching these things, a lot of time, you will get linked up with some people that are not don't have your best interest at heart. So always make sure that you're going to the correct people and calling the correct people. Yeah, just call and always check on that. I mean, it can take 5-10 minutes and save you a lot of heartache in the long run.
And it's always interesting because people will be like, well, do you have, do you work? Yeah, well, then you don't need Part B. Yeah, I know I don't need it. I want to make sure that I've deferred it, right? It's kind of like the context of those little details.
Yeah, and the thing about it is, Catherine was mentioning the penalty on Part B. It's 10%, but there's also a penalty on your drugs, like on drug coverage, which is your Part D coverage, and that's 1% for every month that you go without credible coverage. So it can add up too.
Right. All right. So you definitely the bottom line is you want to sign up for Medicare at 65, the 3 months before, the month of your birthday, and the 3 months after. That is your window to sign up. We are taking your questions, and already I'm seeing a whole bunch of them. Get your question answered, 336-379-5775. We'll be right back.